It's a sign of the times, isn't it, that every piece of new technology that man develops is designed to save us from doing this physical activity. So um, the question then is, in this environment of technology, where every technological revolution is basically designed to make us less and less physically active, how do we actually stem the tide? This lecture is about physical activity, specifically in a health promotion context. So, throughout the course, we've been looking at health promotion as as a method for addressing various health issues within communities and populations. But this lecture specifically is zeroing in on physical activity as a topic for health promotion. Now, the idea that physical activity is good for our health and well-being is not new. In fact, the message hasn't changed much over the last 2,500 years, as you can see from Hippocrates, a quote attributed to Hippocrates. The all parts of the body which have a function, if used in moderation, exercised in labours which each is accustomed, um, become thereby healthy, well developed, and age more slowly. But if unused, left idle, they become um, liable to disease, defective in growth. So he was a very wise man, and just to make him look wiser, I'll give him a pair of glasses. But clearly, the message hasn't changed much. If we look at the evidence now, the epidemiological evidence, so over the last 2,500 years, we've accumulated evidence that physical activity is good for our health. So, diseases such as coronary heart disease and stroke, diabetes, falls, some forms of cancer, psychological well-being, mental health, blood pressure, HDL in particular is affected by physical activity, weight management, and arthritis prevention. Clearly, certainly the symptoms of arthritis can be prevented by optimal levels of physical activity. And the counter to this is that lower physical activity is associated with increased prevalence of all these various factors. So there is really substantial evidence that this is the case. If we look at, there's actually quite an interesting set of slides which trace the prevalence of obesity across the United States over a period of 10 years. And you can see here that we started in 1991 with only a few states in the United States really having high prevalence of obesity, but over the ensuing 4 years and then on to the following 7 years, you can see that especially over the eastern states there was a much higher prevalence of obesity that occurred. And then we move on to the 2002 situation where some of these states are coming in red. So it happened, this prevalence of obesity, this explosion happened over a very short, relatively short period of time. Now, if we go back to the list of conditions that are affected by physical activity, you can see here, as we mentioned, weight loss or maintenance of a healthy weight is actually associated with rates of physical activity. And obesity in itself is a risk factor for some of these other diseases. So physical activity, it's clear that physical activity is a very healthful factor and a very strong determinant of health. And you can see here that if we look at, say, we talk about the burden of disease, that is what proportion of the risk of particular diseases is attributable to certain behavioral attributes. And in Australia, this is work done by Joe Salmon from Deakin University, Victoria, and clearly number one is smoking. But a fairly close number two is physical inactivity. So we've got high blood pressure, excessive alcohol consumption, obesity, diet, high cholesterol, which is linked to diet, and also illicit drug use. So you can see here that physical activity is quite prominent in this equation. Now bear in mind the author is quite an enthusiast of physical activity, so This article focused on physical activity, but even so, physical activity actually impacts on obesity, so there's that extra effect that physical activity has. Clearly, again, a very strong determinant of health outcomes in the population. Now, it's important to understand the terminology, and when we talk about physical activity, abbreviated here as PA, it's not exactly the same as exercise or playing sport. Exercise and sport are subsets of physical activity, but they're not the only way to be physically active. Now, there is a spectrum, and we can have physical activity at the one end, and we have sedentarism at the other end. And they're not necessarily the same things. They're on the same continuum, but it's important to recognize that sedentary behavior itself is quite an unhealthful activity. So if we look at the prevalence of physical activity in Australia, or physical inactivity, we see it is quite prevalent. So we can see here that almost half of the Australian populations are not sufficiently active. And this is twice as much as problems with smoking, and 3 times the issue of high blood pressure. But when we look at how much money, how many resources, the workforce involved in physical activity, it's substantially inferior compared to other pursuits, other priorities within the preventive health budget.